Fentanyl. We're talking a lot about it lately. How it's getting into our schools, how it's getting across our borders. Not a lot of concrete solutions yet, but I've got one to talk to you about tonight, born out of a deeply profound tragedy. I want to show you a picture here of Josh Siems. Josh died last year on his 31st birthday. He spent hours in a hospital ICU after an overdose. Josh had struggled with substance abuse for years. Well, Josh's family already knew the prime suspect in his death, fentanyl. It's killed more than 5,300 people in Maryland in the last 2 years. But fentanyl didn't show up in any of Josh's medical charts or reports. How come? Well, because depending on what hospital you go to, some aren't testing for fentanyl as part of a normal toxicology screen. And that's led to some unintended consequences, not only here in Maryland, but across the country. Josh's father, Bob Siems, is here with us tonight, his partner Melanie Yates, and Maryland State Delegate Joe Vogel, who represents Gaithersburg and Rockville. You all are working to pass a law requiring emergency rooms to test for fentanyl when they order toxicology screenings. I want to get to that in just a second, but Bob, first, can you just tell us about your son?
Yeah, Joshua was born in 1994. He's a twin. His brother Billy lives in Austin. And he was very artistic, very theatrical, sang in Glee Club and Traveling Man, and was, by all outside appearances, doing very well. And he went on to college, and at one point in college then some of his friends were given some OxyContin, and he and a couple of his friends ended up addicted. Yeah. And that began a long slide downwards. He was able to recover for periods of time, for long periods of time, but unfortunately, it caught up with him. The fentanyl is incredibly powerful, and
that's why we're here talking about this. Why do you all think it's necessary that hospitals should be mandated to test for this in toxicology screens? Melanie, you want to handle that one?
Absolutely.
Yeah, Melanie.
So I'm looking kind of at the broader public health policy data off of this. So all of our overdose data, fatal and non-fatal in Maryland, comes from our hospitals. So if we're not testing for fentanyl, we're losing out on data on the biggest killer in our nation, and responsible for more than 80% of fatal overdoses in Maryland in 2021.
This could potentially reveal that the problem with fentanyl is a lot bigger than any of us know about if there's additional overdose deaths that just haven't been categorized as fentanyl deaths, right?
Fentanyl deaths and non-fatal overdoses. We're talking about kids who smoked marijuana and it had fentanyl in it. They'll swear up and down it had nothing in it, and their test comes back with fentanyl. Yeah. So how many of those non-fatal overdoses are we actually missing, and how are we not able to implement programs in Maryland if we're not actually having that data? So
you all were all in Annapolis today. Bob, you were talking with other lawmakers. Obviously, Delegate Vogel is one of the sponsors, the sponsor of this bill in the House. How were you received by the legislators?
I thought we were very well received. My wife Carol was with us there, and I think that everybody was extremely polite and empathetic, and wanted to hear what we had to say. And it would seem to most people to be a pretty clear-cut situation, because fentanyl use just continues to expand nationally, and it's just going to get worse because it's much less expensive to put on the street than other narcotics.
I think it's pretty telling here that even the Maryland Hospital Association has not come out opposed to this bill. We have a statement from them that we can actually show, where they say in a letter to the legislature, in general, we do not believe that clinical practices should be legislated, but again, not coming out against it. So Delegate Vogel, is a bill like this a slam dunk?
Well, we're not seeking to legislate clinical care, right? What we're saying is that if you're testing for the standard federal 5 drugs that are currently tested for in toxicology screenings, considering the prevalence of fentanyl in our communities, we believe you should also be testing for fentanyl. And let me just say, it's been the honor of my life to work with Bob and Melanie on this legislation. And this is a bill that has bipartisan support in the legislature. As of today, it has the support of our new governor, Governor Moore, because he is, and we agree with him in that we need data-driven solutions to this epidemic of fentanyl overdoses, and this will help us move in that direction.
You know, I would imagine for both of you, it just might be so easy to just throw your hands up in the air and say, we mourn Josh, but what can we do? Here you are taking action. Why was it so crucial for you both to take this action?
Well, let me just jump in here. Melanie is the one who really took the lead. Melanie sat in the hospital with Carol and me for 3 days. Half
7 days.
Yeah, it was a long, felt like, yeah, a year. And she started to do some research and realized, well, we knew already that fentanyl wasn't showing up on the hospital reports as the cause of death. And she started to do some research and found that in California they passed some legislation that requires this. And go ahead, Melanie.
Would this, before you tick on that, would this have made a difference if a tox read had come back and it said fentanyl in the system? Could they have done something different?
For Josh, no. If we're looking at the California bill, that's from a woman named Julie Siems, and she lost her 19-year-old son in 2018 to a fentanyl overdose. He went to the emergency room the day before, had a stomach ache. He said he had taken too much Imodium, and Julie had asked the doctor 3 separate times if he had tested for fentanyl.
Yeah.
He claimed he had, and the next day her son overdosed on fentanyl.
So it would have made a difference in that.
It would have made a difference in
This
that one.
is the kind of story that people need to see. We need legislation like this because we're talking about this fentanyl problem. There are very few solutions out there. This, if just could save one life, that it would definitely be worth it. Thank you for your work on this, and thank you both so much for coming in. Bob Siems, Melanie Yates, Delegate Vogel, thank you. And we'll be right back with